The Importance of an Active Lifestyle for the Older Adult, presented by Michelle Logan, Stephanie Martinez, and Amanda Rosnick. The objectives for this presentation are: 1. The student nurse will explain the importance of maintaining an active lifestyle in the older adult. 2. The student nurse will explain the health benefits related to staying active in the older adult population. 3. The student nurse will explain the different ways the older adult can maintain an active lifestyle. And 4. The student nurse will explain the different theories related to aging. Now, there are several theories of aging. However, the two most important are listed in this presentation. The first one is the activity theory. This states that an older person should continue a middle-aged lifestyle, denying the existence of old age as possible, and that society should apply the same norms to old age as it does to middle age, and not advocate diminishing activity, interest, and involvement as its members grow old. The second important theory relating to this presentation is the continuity theory. This theory states that personality and basic patterns of behavior are said to remain unchanged as the individual ages. It encourages the young to consider that their current activities will lay a foundation for their future old age.
Next, we're going to talk about the changes related to aging. First, we're going to discuss the respiratory changes related to aging. As we age, oxygen in the blood is reduced as much as 15% between ages 20 and 80 years of age. The lungs also lose elasticity over time and have an increase in rigidity, causing forced expiration volume to be reduced. Your cough and laryngeal reflexes are also weakened, and by 90 years of age, there is approximately a 50% increase in residual capacity, which is the amount of air that's left over in your lungs after you exhale. The alveoli, which are the tiny air sacs in the lungs, also become fewer and larger in size, and your thoracic muscles become more rigid. Your reduced respiratory activity associated with aging also puts you at increased risk for developing pneumonia very easily, especially when you're immobile. Next, we're going to discuss the cardiovascular changes related to aging. As we age, arteries in the head, neck, and extremities become more prominent and pronounced. Valves of the heart also become thicker and more rigid. Your stroke volume, or the amount of blood that's pumped from the left ventricle, decreases by 1% each year as we age. Oxygen is also utilized less efficiently in the body. The aorta of the heart also becomes dilated and elongated. The cardiac output, or the amount of blood that's pumped by the heart per minute, decreases as well. Resistance to the peripheral blood flow increases by 1% per year, meaning your blood pressure increases to compensate for the increased peripheral resistance and decreased cardiac output, and the vessels become less elastic. Inactivity can also cause cardiac atrophy. Age-related cardiovascular changes are most apparent when unusual demands are placed on the heart. Next, we're going to discuss the gastrointestinal changes. As we age, we lose sensation of taste in our taste buds and other places on the tongue. The esophagus becomes more dilated. Saliva is also reduced. The liver becomes smaller in size. Blood flow to the intestine is also reduced, and esophageal motility begins to decrease. The gastric mucosa begins to atrophy, and stomach motility, hunger contractions, and emptying time also decreases. Peristalsis, or the wave-like movements that push contents through the intestines, also begins to slow down, and this can worsen with inactivity or a sedentary lifestyle. Musculoskeletal changes related to aging. Sarcopenia is the age-related loss of muscle mass, strength, in function, and this is mostly seen in inactive people. The decrease is more prominent in the arms and leg muscles, which become particularly flabby and weak, and these, like I said, are displayed very well as we age. And neuro changes related to aging. As we age, brain weight decreases along with reduced blood flow to the brain. Reflexes also begin to slow down, and the circadian and homeostatic factors of sleep regulation are also altered with aging. Changes in the sleep pattern will occur, especially with stages 3 and 4 of sleep becoming less prominent.
Why is an active lifestyle important? Physical activity has been directly linked to slowing the process of mental decline. When you stay active, every part of your body, including your brain, receives more blood flow. Blood flow encourages cell growth. This also helps you maintain or lose weight. Exercise improves your strength and posture, which in turn helps with balance and coordination, which will reduce fall risk. Regular activity can help you have a better night's sleep and feel more energetic. Exercise can help prevent memory loss, cognitive decline, and dementia. Regular exercise helps maintain muscle strength and tone and reduces some of the negative functional consequences of aging. Benefits. Regular physical activity can reduce the risk of or help manage chronic diseases such as high blood pressure, stroke, coronary artery disease, type 2 diabetes, colon cancer, obesity, and osteoporosis. Helps maintain healthy bones, muscles, and joints. Helps control joint swelling and pain associated with arthritis. Exercise can be a social event and can be a great way to stay socially active. Exercise can affect mood and disposition. Exercising releases endorphins, which can help lessen feelings of depression, sadness, and anxiety. Exercise can improve both strength and mobility. Without exercise, the older adult can suffer from atrophied muscles, difficulty breathing and walking, unsteady balance, poor blood flow, and other physical problems. But what if you don't like to exercise? You can listen to music or an audiobook while lifting weights. Window shop while walking around the mall. Instead of sitting and socializing with a friend, walk around the block and talk. Find a workout partner to go to yoga class or fitness classes with. Watch TV while on the treadmill. Walk or play fetch with the dog. Go for a walk or run when feeling stressed. Go outside and get active. The 4 building blocks of fitness. Balance. Helps maintain standing and stability. Improves balance, posture, and reduces risk for falls. Cardio. Helps lessen fatigue and shortness of breath. Improves endurance by improving endurance for daily activities such as walking, house cleaning, and errands. Strength and power training. Helps prevent loss of bone mass, builds muscle, and improves balance. Flexibility. Helps your body stay limber and increases your range of movement for activities such as tying your shoes, driving, shampooing your hair, and playing with your grandchildren. Active social stimulation. Activities include art classes at a local arts and crafts store, weekly bingo groups, visiting friends and family, talking on the phone, church activities, organized multi-age social groups, travel, and sporting events.
Okay, the different ways to actively stimulate your brain. Activities include taking courses at the local community college. Games like Sudoku or crossword puzzles can help keep your brain active. Computer-based programs, and engaging in a debate. Different ways to actively physically stimulate yourself include golf, signing up for a gym membership, walking briskly, doing yard work, actively playing with children, biking at a casual pace, scrubbing the floor, water aerobics, jogging or running, swimming laps, playing sports, and skiing. And if you need more information on brain stimulation, on mood stimulation, and physically getting active, please ask your local senior citizen center, recreation department, hospitals, fitness centers, churches, community centers, and schools. These are our references, and we thank you very much for listening to our presentation.